Hello and welcome everybody to this week's edition of It's Worth a Shot. Kyla Newland
Thank you.
here, account manager at Mountain Pacific up here in cold Alaska. I know it's cold in most of your states right now, in exception of Hawaii. We're always jealous of that. So today we're going to be talking about, we're going to have some in-house presentations from my colleagues Shay and Callie, talking about infection prevention and control program and staff training and competency. We can go to the next slide. So just a disclaimer, we do feature some outside presenters for some of our sessions, and this does not mean that we're promoting one facility or service over another. We're just spreading information. We can go to the next slide. So just a few updates and reminders. I know last week we had a question asking about how effective this year's influenza vaccine was. And there was a study that came out. So usually what we'll see is the Southern Hemisphere will get their flu season earlier than us, about 6 months earlier. And so we use that data to look at what we think is going to happen in the Northern Hemisphere. And what they saw was a very significant, around 50% reduction in hospitalizations in patients that had received the influenza vaccine. So that was a very good sign that we are getting some good coverage. And as far as some data for us, we don't have solid numbers yet for this year's vaccine, but we do know that anecdotally we've seen from providers that are seeing patients saying, yes, it looks like patients that have gotten the influenza vaccine are having pretty good coverage and not getting as sick. So that is good news for our flu season. And then we also just wanted to share the updated adult immunization schedule from the CDC, which has been updated to include COVID vaccine as part of the routine vaccine schedule, and then also the addition of RSV to that schedule. So check those out, really good resources to keep track of which vaccines your patients need. Or residents. We can go to the next slide. So we do have a polling question today. We can bring that up. And as always, please send ideas. Please fill out our evaluation after each session and give us feedback on topics that you might think we could present on in the future. So our question is, has your facility tried putting flu and RSV optional vaccine data into NHSN yet? So it's looking like it's 50-50-ish at this point, which is awesome. Okay, so about 40% of folks, it looks like, for our final number. So that's great. Thank you. We can go to the next slide. So as we're seeing our influenza snapshot here, it looks like Montana and Wyoming are seeing high levels or very high levels of influenza currently. And then if we look at Alaska and Hawaii, we're a little bit lower. But you can see across the country, you've kind of got a lot of red, dark red, purple going on. So we're still seeing a lot of high flu activity across the United States and across most part of our region. We can go to the next slide. And then our COVID snapshot, we are seeing kind of a flattening out or a decreasing of emergency room visits, but we are seeing an increase in deaths and hospitalizations. So that's kind of what we see when we see a peak of COVID is we'll see the emergency department visits peak first, and then we'll see the deaths and the hospital admissions kind of follow. Deaths is going to be kind of like our final peak if we're having a surge. So just be diligent and use your PPE. Go to the next slide. So I will turn it over to Shay to talk to us today, and I'll let you take it away, Shay.
Thanks, Kyla.
Welcome again, everybody. We're happy that you can join us. For most of us here in Montana, we're seeing an increase in temperature, so I'm very happy to be above freezing today. But with that, I wanted to kind of touch base on our favorite FTAG 880, the Infection Prevention and Control Program specifically. This one, mainly I want to focus on aspects that where I'm seeing maybe we're missing or have an opportunity to enhance. Next slide, please. So the IPCP meeting and agenda. This is something that I really wanted to touch base on today. You guys are doing a great job out there from what I'm hearing across our region, but I wanted to offer a few resources that may help develop this. The other thing I wanted to briefly touch base on too is that your meeting needs to be separate from your quality improvement or QAPI meeting. It doesn't have to be an additional day or time, but it could just be at the end of your meeting. You can take however long you designate, maybe 15 minutes or 30, depending on what you have going on, to dedicate towards the IPCP meeting. And then additionally, you want to set your agenda ahead of time, just so you can identify those key players that need to be in the meeting. Next slide, please. All right, and this is just, I guess, for lack of a better term, proof that they are looking for that IPCP meeting, the policy, the procedure, and it's just an outline for surveyors to look at. So just keep this in the back of your mind and just know that at some point it'd be helpful to enhance it. Next slide, please, Mary. All right, so at this time, I am going to show you guys a template that some of you may know or may have seen, but it's a great opportunity for you guys to utilize it. Again, risk assessment tool for infection prevention. So here, I'm going to share my screen if I can. All right. Can everyone see my screen? All right. So this is the SPICE website. And you guys, if you're not on this University of North Carolina SPICE website, it's a great opportunity to find a lot of outstanding resources. So with this, they have in here the infection prevention and risk assessment, and it's a free download. So that might be something that you guys can look at just to make sure that you're able to get on and edit it. So this is the tool that I'm looking at. Again, some of you have used it. I believe there's actually a few facilities on the call today that have used this tool. So you go through and again, it gives you some topics on the side. And again, you can edit and revise as you see fit. But internal factors, like they look at your urinary tract infections. And again, on the columns, you'll see the probability of occurrence and you can rate them. So your risk of failure, potential change in care, and the preparedness in the year. And again, these are aspects that you guys can go through as infection preventionists and identify and rank them. And then you can use this as your template to move forward in your IPCP meetings. So again, this is kind of your starting point. If you have one already in process, that's great. If you guys need a template, again, this is an excellent resource that you guys can utilize. So I will go back to the slides. Mary, if you wouldn't mind, next slide. Oh, there should be another slide in there. Okay, so we'll go back. There's another one that I wanted to share for some reason. Sorry, it got removed. But the next thing that I would like to go over with you guys is also a very valuable aspect. Again, it's an agenda template. And for those of you around Montana or maybe outside of Montana may have worked with Terry Hewlett. She's an infection preventionist, and I believe I saw her on the line on our participants. So Terry, thank you for bringing this forward. But again, it's an excellent resource, and I will go ahead and share my screen again just so you guys can see this. Okay. All right. Okay, so you guys should be able to see this. Now, it's something that, again, I've got the okay to use. But again, it's an infection control and committee meeting agenda template. So this is, again, another great resource that you guys could use to get your meeting in line, to kind of focus your agenda, focus your meeting. As we all know, they can get sidetracked. And again, we want to be very cognizant of everybody's time, especially if you have your medical providers in there or your medical director. And again, everybody else who is on or is in that meeting. But again, it just gives you great ideas for topics, kind of gives you a time limit. And again, this doesn't have to be the minutes that are on here. It's easy to edit. And then the driving factor on this would come from your risk assessment as well. So you can add those that annual risk assessment right here. You can add that in there and talk about it, but then also to use that to drive your meeting. So again, these are just a couple of resources that I really wanted to focus on today, because I've been asking a lot of facilities if they are separately doing infection control committee meetings. And this is what I mean by them. And again, I know death by meeting, but again, I wanted to make sure that everyone has this available to them, because it is something that we're seeing being looked at. So, okay, I will stop sharing, and then Mary, go ahead. So I know, again, we have a lot of time that we have to dedicate towards meetings, but these are just a couple of aspects I wanted to touch base on. So with that, next slide, please, Mary. I will go ahead and turn it over to Callie. And then again, I saw some questions in the chat, so I will go ahead and answer those as Callie presents. Thank you, everyone.
Okay, great. Thank you, Shay. Such great information. And Terry, again, thank you for sharing that. What a wonderful resource. Let's go ahead and go to the next slide. So today we're going to talk about staff training and competency. This question came up a couple of weeks ago. We had talked about what the requirements were. We just kind of touched on what retention schedules were and whatnot. So there was a question about competency. So I thought, this is such a big topic that we would go a little bit more in depth. And I'm telling you, even these 15 minutes we're going to talk about it, I think we could go on for days about competency and training. So we are going to touch on this. This is the definition from CMS for competency. So again, it's a measurable knowledge, a measure of knowledge, skills, abilities, behaviors. And this is one way that we assess our staff, whether or not they can perform their work roles and the functions successfully. It's important that when we're looking at competency, that we are making sure that the company assessment, it identifies the strengths, and then also that we're looking at opportunities for growth in our staff. When we do these competency assessments, we can also prioritize goals for staff development for the entire facility. So both on the individual basis and as a facility, looking for what opportunities we have for developing programs and different training for the upcoming year. So just like Shay talked about in the infection prevention, we want to do kind of a previous year look. You know, maybe we had more problems with hand hygiene, maybe we had more problems with abuse and neglect. So coming back and reviewing our staff training and competencies is a good, and maybe taking a look at that annually, it's a good opportunity to improve the program overall. This is also a really great tool to have those conversations with staff. So management can use these during one-on-one conversations to make sure that staff are applying what they're learning in their roles. CMS developed a nursing home staff competency assessment. It is not a required tool, but staff competency is required. So however you guys assess staff competency, that is a required function. Ensuring staff competency can help your facilities avoid and prevent deficiencies and even IJs, and especially when that comes to abuse and neglect. So let's go ahead and go to the next slide. So we're going to talk about competency versus training. So competency differs from education and training, and that competency incorporates knowledge, technical skills, and ability. And you guys have probably heard of KSA. That's just a quick acronym for knowledge, skills, and abilities. So when you're looking at training programs, you want to make sure that the KSA of that is built in. So remember, just because staff is trained on something does not mean that they are necessarily competent in that. So you want to make sure that the staff training program is also building those staff competencies, and you're developing those staff competencies. So have a method for providing the training and looking at implementing some kind of actual application of what's trained. Just as a reminder, I want to kind of just touch on the guidance. So F940 covers the facility training program. And under F940, there's multiple different sections that are all required. So 941 through 949 touches on all of the different specific training required components. So, and I attached that in the training a couple of weeks ago that we did. We won't go into depth on each one of those training requirements, but I did want to touch on that. Just as a reminder, there are specific components that are required for training. And again, training. F726 then talks about the nursing staff competencies. So I had a conversation with a surveyor, and just as a reminder, you may be found deficient in multiple areas. So if it's communication, you may get the 941 tag for not training your staff on it, but also it may go into like an abuse or neglect. So just as a reminder, you may find that those tags can kind of overlap. So just as a reminder, F726 will only be found deficient if it's pertaining to nursing staff. So when you look at competencies, competencies should be applied to all of your staff, but F726 specifically applies to nursing staff and nurse aides. Let's go ahead and go to the next slide. Okay, so as we look at developing our training needs, there's a couple of ways that we can gather information about what needs to go into our staff development programs. So one of those is the facility assessment. So when you're looking at your facility assessment, you're reviewing your resident specific needs, their plan of care, any specific cares that you're providing within your facility. All of those things need to be rolled into your staff training program, and then looking at competency to assess that they've learned that. One of the big ones that we see right now is behavioral health needs. So as a reminder, we do have the Centers of Excellence, and obviously we're available for technical support as well. So that's a good one, just a good example of that I feel like is often missed. When you guys are doing your facility assessment, you want to make sure that you're including an evaluation of your staff competencies to make sure that you're addressing your population. So again, whatever those resident needs are, and then make sure that your facilities assessment determines what resources are needed as well. So a couple of other things that we can look at to identify training needs are your performance appraisals of your staff. If you have your staff do a self-competency, if they identify specific areas that they would like additional training on, make sure you guys are addressing those needs. And also, if there's any requests for training, you should make sure that you are also addressing that. And then finally, making sure that you're covering all of the required training. And again, I listed some of those previously, but hand hygiene, infection prevention, the behavioral health, abuse, neglect, all of those things are required. So make sure you know what those requirements are. Let's go ahead and go to the next slide. So I just wanted to kind of quickly touch on the nursing in services. Just as a reminder, there is a survey pathway that talks about sufficient and competent staff. So make sure you guys take a look at that. There are requirements for the 12 hours per year. I know in talking with some of the infection prevention staff and some of the directors of nursing, I know that getting staff to do their 12 hours per year and attend those trainings is extremely difficult, but just as a reminder for the facility, it is required. Make sure that for your nursing and services, you're covering dementia, abuse prevention, all of those are required. And then if there's areas of weakness, again, that self-assessment, that we are addressing that. If you're finding that a staff cannot, perform a skill competently, that we're addressing that and providing that coaching and additional education is needed. And then the last one is the cognitive impairments. Again, there's some guidance for providing staff training. The links will come out with the slides. I won't go into a lot of detail on that, but just as a reminder, there's a lot of different rules and regulations regarding the staff training. So make sure you're looking at all of that. And then let's go ahead and go to the next slide. So I talked a lot about the nursing home competencies, but I did want to just touch quickly on the hospital staff competency. There are some rules regarding that. So in their standards manual, and I've actually listed page 109, they need to have the initial training and then the ongoing training every 2 years after. So just making sure that you're meeting that as well. Let's go ahead and go to the next slide. So some considerations when you are looking at your staff training programs, you want to make sure that you are reviewing the state licensing boards. So if you have therapy staff, social work staff, nursing staff, everybody has their own different requirements. Your infection preventionists, they have their own requirements for what training is needed for them and what they need to be competent in. So make sure you're considering that when you're looking at the staff education for your upcoming year. The other one is looking at your licensing and survey requirements. I know I used Wyoming as a specific example. They have some specific rules regarding the documentation and what's required of that. The other one is your corporate requirements for some of your facilities who are affiliated with different corporations. You want to make sure that you're meeting those requirements as well. So it's a lot to consider, a lot of work for your staff education department. So we want to make sure that we're meeting kind of all of the powers that be in those requirements. So take all of those things into consideration as you move forward. And obviously, just as a reminder, we oftentimes tend to use different like training videos and platforms, those kind of things. So just make sure that you're meeting the needs of your staff. Some staff, need help with like language services and having resources available in different languages. Some need assistance, like reading level, those kind of things. So just take all of those factors into consideration as you develop your training programs. And then let's go ahead and go to the next slide. I did include the links to that nursing home staff competency assessment. I've also included the instruction manual and a training video and the toolkit. So if you guys decide to use that, there's all of the links there. It does kind of walk you through every component of that. So it should make it pretty simple if you guys decide to use that competency assessment. And again, from a legal standpoint, if you have a staff member that, say that they didn't learn something, even if they signed off or they attended the training does not equal competency. So if they're saying that they don't understand something, make sure that you have that follow through and close those loops. Jolene, thank you for adding that. Jolene added the link for Hawaii, so you can check out the licensing and training requirements for Hawaii. Again, I have some links with the slides that we can send out as well for some additional information. Montana had a really great curriculum requirement PDF as well. So make sure you're checking out those state boards of nursing and, therapies, those kind of things. So, all right, let's go ahead and go to the next slide. And just want to circle back. Did anyone have any questions either for Shay or myself? We can follow up. Shay is going to email the template out that she presented today. And let's see.
Yeah, I'll go ahead and send that out to the listservs. You guys, so if you don't get it by the end of the day, please check your junk email box and just make sure that it's not going there. But because we've had a lot of individuals say that our stuff is going to the junk mail. So I will be sending that out here after the meeting.
All right. Thank you, Shay. If there are no other questions, let's go ahead and go to the last slide. Mary went ahead and dropped the evaluation into the chat. So if you guys wouldn't mind, we really do appreciate your feedback and your ideas for training and education. And then just as a reminder, as always, every Wednesday, join us and we will have another episode of It's Worth a Shot. And we are going to have a full presentation next week on IP national reporting. So please join us. That should be a good one. So on any of these topics presented today, just as a reminder, your account managers are here. We can offer any kind of technical assistance and support, resources. So don't hesitate to reach out to us. We are always here to help. And again, as we move into the new year and looking at our staff training, like I said, don't hesitate to reach out if you need ideas or resources. So we are always happy to help. So thank you guys. Have a good day and we will see you next Wednesday.